This is my NG pass-off video. So the first thing I'm going to do is I'm going to verify the order for the placement of an NG tube. And then I'll gather my supplies and make sure that I have the right tube length and tube size for the NG. I'll come in, I'll perform hand hygiene and put on gloves and PPE if necessary. Well, not gloves yet, but hand hygiene and PPE if necessary. I will walk in, introduce myself, close the curtain and the door for privacy, introduce myself to the patient. So, my name is Kylie, I'll be your nurse today, and then explain the procedure to the patient. I will be placing an NG tube, explain to the patient that this is an uncomfortable and slightly painful procedure, and then if they have any questions beforehand or after or during the procedure, that they're more than welcome to ask me. And then I will raise the bed to a comfortable working height. And then put the patient in a high Fowler's position or 45 degrees. And then put them in a high position. And then I'll open my supplies and get my supplies ready. Once the patient is in this position, I'll drape the drape over their chest and under their chin to catch any saliva or any other contents that might come out during the procedure. And then provide the patient with an emesis bin in case they feel the need to vomit during the procedure. Have tissues by the bedside as well within reach, and water as well for when I start inserting the tube. And then I'm going to get my tube ready. So before measuring the tube and inserting the tube, I will assess the patient's nostrils to determine which nostril will be better placement for the tube. So to do that, I will either ask the patient to plug either side of their nose and breathe out, and ask them which nostril it is easier to breathe in and out of, or whichever nostril is bigger. For this patient in particular, it will be the left nostril because it is bigger and easier airway access. And then I will measure the tube from the tip of their nose to the tip of their earlobe down to their xiphoid process. And it's 54, and then I'd mark that with a marker, and then put on gloves and prepare to insert the tube into their nose. So then with the tube, I will lubricate the tip of the tube 2 to 4 inches, preferably 4, so that it's a more comfortable insertion for the patient. And before I insert the tube, I'll have the patient tilt their head back against the pillow a little bit so that it's easier to insert the tube and they have a more open airway. Then I will begin to insert the tube slowly without any force. And as I'm inserting the tube, if I hit the pharynx of the patient, it will be painful. They will begin to gag and or cough. If the patient is gagging or coughing or has trouble breathing or they begin to show signs of cyanosis or they cannot talk or hum, I will completely extract the tubing, allow the patient to calm down, and then begin the procedure. To check correct placement, or if the tube is being inserted correctly, I will ask them to open their mouth and use a tongue blade and a flashlight to make sure that the tube is going down the back of their throat straight. If it's coiling or bending, then I'll also, again, extract the tube and begin the procedure again. Insert the tube, and while I'm inserting also, I will stop inserting when the patient is breathing, taking a breath, and then have them take drinks and swallows to help with lubricating the throat and make it a more comfortable procedure. Keep inserting all the way to my mark, which was 54. So once I've reached that mark, I will then secure the tubing to their cheek temporarily, and then once I secure it to their cheek, I'll mark the tube at their nose. And for nasogastric tubing, to ensure the correct placement in the stomach, we can do one of two ways. The more appropriate way is to do an X-ray to see the placement of the tubing, but for this case, we will be doing taking a syringe, a 60 milliliter syringe, and attaching it to the port of the tube and extracting stomach contents. So then I will come over here. And you want to close this port off to ensure no stomach contents come out. So you attach it here, and you will excrete stomach contents. After that, you will want to make sure that this is secure. This is closed off as well as this one. It's there. Then you will put the contents into a little medicine cup and assess the pH. So do your little dipstick, assess the pH, wait 30 seconds. pH, the normal pH pH level for stomach contents is 5.5 or 5.5. If you read a level of 5.5, then your placement of the tube is correct. And you will then come back and you now have to secure the tube to the patient themselves. So then nope, take it back. Now we have to secure the tubing to their nose. So before I do that, I will apply a skin barrier to the tip of their nose and then let it dry. And you will take a 4-inch piece of tape and split it up the middle about halfway. And apply the tape to the bridge of their nose. And you can remove this for now. Being careful, extra careful not to tug or pull on the tube. You will then secure it by wrapping each flap of tape underneath and over the top of the tube to keep it secure. Again, not pulling on the tube. And then if the patient would like, you can secure it back to their cheek, or we can also have the patient turn their head to the opposite side of the placement of the tube and then secure it to their shoulder using tape and a safety pin, but in this case we'll just use tape because that's what we've got. Secure it with tape, and the patient turns their head to the opposite side to ensure that they've got enough slack when they bring their head back. They have that enough slack so that the tube is not tugging or pulling when they move their head up and down or side to side. Secure it here. You'll then mark the tubing again as well to ensure where the tubing is so that it's not, so you can see if it's moved or if it's being pulled out. If your tubing is a double lumen tube, you will make sure that it's placed above stomach level and that both of these ports are closed off so that no gastric contents come out. And then you can hook it up, secure it up here up here, and connect it to suction if that's what the doctor's ordered. And record when you document, you'll record how much tubing is left from the tip of their nose to the end of the tube. And then I'll put the bed back down to its lowest position. Lower the head of the bed of the patient to where it's comfortable for them. Ask them if they have any questions. Throw away my stuff. Make sure they are clean. For the patient, I will perform oral care every 2 to 4 hours and provide them with either a nasal throat spray or a nasal throat spray, or and then either lubricate their lips with chapstick and lubricate the inside of their nostrils so there's no dryness or cracking, and perform hand hygiene, remove all my supplies, and document.